A 39-year-old male came to the office concerned that the left side of his face was gradually getting bigger. This turned out to be significantly more serious than some mild facial swelling. Check out the first video of this multi-part case today on the open reduction. Welcome to the Open Reduction, your channel covering all topics oral and maxillofacial surgery. I'm Dr. Tom Bolten, and today is the first video in a huge case. This patient is a 39-year-old male who saw a different surgeon 11 years ago for a growth in his left lower jaw. It was removed, and at the time he was told it wasn't cancerous, so there was nothing else to do. Flash forward 10 years, and now he has a noticeable facial asymmetry. The left side of his face appears swollen. He's not in pain, but he can tell there's a problem. I take a look, and immediately I can tell there's a large issue going on here. There is a visible mass in his left posterior mandible that's causing expansion of the tissue. There's a purple hue at the center of this lesion. I obtained a cone beam CT, and this is what I saw. There is an enormous radiolucency in the left mandible extending from the body all the way to the condyle. It is causing expansion and destruction of bone. The differential on this lesion includes an odontogenic keratocyst, an ameloblastoma, a central giant cell granuloma, and a myxoma. The first step is establishing a diagnosis. The patient doesn't remember what the pathology said in 2013, and he's not sure who did the original procedure either, so I need to perform a biopsy and get this tissue to the pathologist. The first thing I do after I numb the area is aspirate this lesion. There is a large collection of dark brown fluid, which suggests a cyst. Next, I make an incision along the alveolar ridge and dissect into the lesion. Now that I can visualize this lesion, I take a sample and give it to the pathologist. This mass is friable and tears easily. I confirm nothing is bleeding, irrigate the site thoroughly, and then close. Thanks so much for watching. On the next video in this series, I'll review the diagnosis and the surgical plan. Check out my channel for other interesting OMFS cases. Click those like and subscribe buttons, and keep an eye on my website, theopenreduction.com, where I'll be posting content to help hone your surgical skills. I'm Dr. Tom Bolten. I'll catch you next time on The Open Reduction.